Hello, I'm Andrea Cooley, one of the owners of Des Moines Mom, and today we have Luann Woolley, who is a nurse practitioner at the Adolescent Clinic with Blank Children's Hospital, and we're going to be talking about puberty and specifically menstruation. So thank you for joining us today, Luann.
Yes, good morning. Good morning to Des Moines moms. And thank you for taking on the topic of menstruation. My
Yes.
husband said, I think I'm glad I'm not here for this part.
Oh, yes, it is. It is something that women, we have to live with. And
That's
as we
right.
have daughters who are growing up and hitting those preteen and teen ages, it's a topic that is important to talk about. And so, as a parent, what things can we expect to see in our daughters as they kind of come into the age of menstruation, and what kind of things should we be looking for?
Wonderful. So as we hit that preteen age, that, 10 to 13, we're looking at body changes mostly. You might see some hair growth underneath the arms, particularly. Breast buds is probably the first indicator of 2 to 3 more years, we're going to see a period.
Okay.
So that's a good time to talk about how your body's changing to start that conversation. And I feel like the best thing we can do as providers, as parents, as caregivers is to not let it be a surprise, to educate them, to normalize it. What does the word menstruation and menarche, those are not the common terms that kids are going to use. What does that mean? And to have them be prepared, because I feel like some kids aren't going to talk about it. They're going to be very private, and
Mhm.
that is pretty normal in the those beginning adolescent years, because
Right.
you don't want to be considered abnormal and you're not sure this is normal.
Right. So you're saying really around, the age of 10 or 11, once you start seeing some of those early body changes in your daughter, that's the time to start having the conversation. And then what age do you typically see a girl start to menstruate, and what would be a normal versus an abnormal start, I guess?
Normal, if you look at the American College of Obstetrics and Gynecology or the American Academy of Pediatrics, their textbook would say 12 years of age. I have seen girls as young as 9 years of age start menstruating. I think it has to do a lot with the size of the girl and other hormones that are happening. Stressors in their lives can be part of that, or that can also prevent menstruation from happening later. So you have to take in the whole picture. 12 is the average age.
Okay. And are there things that maybe would be abnormal that it would be, you would recommend, talking to your provider, or things that, a parent can be on the lookout for that might be a problem?
Concerns would be if menstruation started and then it's been greater than 6 months and there was no successive period. So, what else is happening? We think about hormone changes, the brain talking to the ovaries. Is that whole cycle not working correctly? We maybe draw some blood, get some thyroid, some other levels, hormone levels. As far as initially, no, I've seen 15-year-olds come into the clinic and say, I haven't started my period. And then we start questioning, what was mom like when she started her period? Did everyone in your family start their menses later? That's not 100%, but it could be a concern. Then I go over body changes. When did you start having breast development? Or has that been there for a long time? And then, as simple as drawing some blood just to make sure, alleviate all concerns.
Yeah, I think it is important just to know that providers are there to support us and to help us as parents as our kids are growing and changing. What other ways can parents, be aware of to support their daughter, both, physically, but I also think mentally. It's just such a big time of change for kids, girls in particular.
Well, and there's also going to be some increased anxiety because it's the unknown. So I
Mm-hmm.
think it's just, normalizing, talking, preparing, and just checking in with them. And
Sure.
if you start your period, could you let mom know as far as, this is at least when I started, um, just to kind of get some documentation as far as when's the next one going to occur, or maybe I might feel a little moody prior to that because of the hormone. The progestin usually gets high and then drops off, and that's what makes us bleed. So I think another way to give it some normalization is, giving them some ownership, like getting an app on your phone
Sure.
to record that. And maybe your friends have apps on their phones too. And I see it both ways, like they'll talk about it with everybody or they won't talk about it with anybody.
Sure.
So I just want to bring it up. We consider it in the adolescent clinic as the fifth vital sign. We're taking their blood pressure, we're doing their temperature, but we also want to know when your period is. And is it
Mm-hmm.
regular? Is it not regular? Why not?
Right.
So
I think that's great. I love that it's the fifth vital sign. And then also just encouraging parents to normalize the conversation. I think it can seem intimidating for a parent too, because it's new and it's unknown for us. But if we can partner with our daughters in having those conversations, it will go a long ways in just kind of easing the anxiety for everyone.
right, right. I've went so far as to have girls bring tampons in, and we, how do we do this? What do we do with this? And moms are like, you do it, please. That is fine. I'm glad to be
Sure.
part of that team and have the trust that the adolescent has with a provider, but yet giving them some ownership, independence, because
Yes.
that's the next stage in
Mhm.
this adolescent world is we don't need you anymore, but they do. So it's the tug of war.
Yes.
And yes,
Well,
emotionally is part of every visit. I get
mhm.
into mood. I want to know how they're doing, how's school going, how's friends. Periods aren't the essential topic
Right.
necessarily, unless that's why they came. But I am glad to do education and would love to. And abnormals, as far as another abnormal I didn't hit on, is we're bleeding super heavy. We have really heavy cramps. That does
Mhm.
need to be checked out further. Is there a concern with a bleeding disorder?
Mhm.
More than one cycle that's super heavy, greater than 7 days.
Mhm.
So we do want to know that. The average cycle length is usually 7 to 10 days initially,
Okay.
3 to 6 pads or tampons a day.
Okay. Great.
Happens there. Sorry.
Yeah. Well, thank you so much, Luann. We just appreciate your time and your knowledge, and just want to encourage parents that they can have these conversations and they can partner with their provider just as their children are going through adolescence and some of these changes.
Wonderful. Thank you. And know that we are a resource at the Blank Adolescent Clinic.
Yes. Yes. Thank you so
All
much.
right.